Well,
so that's my background, basically. I worked on SARS at the NIH for 3 years.
And I think one of the things that I've learned throughout my education has been, one of my professors always talked about, if you don't know where you've been, you don't know where you're going. And so I think before we can look forward, it's like, let's take a look back at history and see what has happened. How did we, respond to SARS and even things before SARS, so that we can address things and maybe help expedite,
Sure.
Positive things for the future. So
Sure. So lessons learned from SARS.
yeah.
SARS was around for about 8 months.
Mm-hmm.
It started in southern China. It came to the human population through an animal that was sort of like a weasel called a civet cat or a palm civet.
Okay.
So they knew sort of right away from doing antibody and virus tracing in humans in the market where it sort of had an outbreak. They started testing animals, and only certain animals had antibodies to it. So they were able to identify the animal reservoir pretty quickly. And so then the Chinese government took radical action and killed tens of thousands of those animals just to get them out of human contact. And then that outbreak of SARS caused pretty serious disease within about 5 days of being infected, 2 to 5 days. People would come down with very noticeable symptoms, high fever, cough, body aches, and it would progress pretty rapidly to more severe lower respiratory issues and some pneumonia and some fatalities. And the overall fatalities for SARS was about 10%. And like with this virus, if you were older, if you were sort of older than 65, you were at a higher mortality risk with the original SARS. And for each decade older, the fatality rate was even higher. And so, but the overall fatality rate for the original SARS was 10%. And it affected just over 8,000 people and killed just under 800.
Wow.
So, yeah. But it went away in 8 months, and most people attribute the ability to get rid of that virus to several public health interventions. And then there was also a little bit of speculation, did it go away because of the warm summer months? We don't really know if that contributed at all, but we do know that culling all of those civets, practicing something called barrier nursing or barrier protection, where you, where the nurses and the healthcare workers would wear masks and goggles and gloves and suits, Tyvek type suits when treating patients. They would isolate patients because they were sick. They could test them, and then they would do contact tracing. And they would trace all of the contacts that sick person had come in contact with for the previous week, and then they would isolate those people. And so by isolating the sick and isolating their contacts and going out two rounds of contacts, so those people they would ask, who have you contacted? They would isolate those people in their homes, not in hospitals. Basically, that stopped the spread. So it moved across China, parts of China, into Hong Kong, different parts of Southeast Asia. There was a really bad hot spot in Toronto, but it didn't really get out into much more of the country or the world. It got into 27 different countries, but we're already in over 160 countries with SARS-2.
Wow.
And it's been here since December, and this is only March, so it's only been 4 months, half the time. 3, 4, what's the math there, between 30 and 160, at least 5 times more countries. And I haven't looked at the latest numbers, but the last time I looked, it was well over 210,000 people infected. So, yeah. So this one's spreading a lot further, a lot faster, and part of that is because people can have the virus replicating. They can actually give it to somebody else and really not even feel bad themselves, and that number can be pretty high. I don't actually think it would be good to speculate at what the number is. I've heard a couple of drastically different numbers. I've heard as high as 80%, and I've heard as low as maybe 20% of people who spread it don't know they have it.
Okay. Was that the case with SARS?
No. So you could spread SARS before you had symptoms, But being completely asymptomatic with SARS was not common at all.
Okay, so that makes this a trickier kind of virus.
Very trickier, so I don't think we're going to be able to isolate, contain, and trace. We can certainly still practice the barrier nursing. We don't know what the animal reservoir is, so nobody's gone out into nature and tried to get rid of the animal that delivered it to the human population in the first place. But the good news is, if we can say that there's good news so far, the overall mortality rate seems to be lower. I would say a lot lower, but the longer it goes on, the more the mortality rate on a global level seems to be creeping up. And so the first couple of weeks that I was tracing this, the first couple of weeks of February, the global rate was around 2%.
Okay.
And just this past week, it's just crept past 4%.
Okay.
And so it was holding between 3 and 4% for several weeks, but it seems to be creeping up. And it could be because there's a lot of people scrambling, and it's hit Italy really hard. The mortality rate in Italy last time I checked was just under 10%, so pretty bad.
That is. And as we're talking about this, we can, in a sense, talk about it, from our personal hypothetical perspective. But all of these questions that I have, there's some overarching ones that are just more of, understanding it, learning more about it, learning how to stop it. But then there's personal stories, there's personal lives. Like, obviously, we're all affected by this at this point.
Right. We really should be 6 feet apart. Yeah. But we trust each other, and both of us have been healthy, and your kids have been healthy. And
we're staying at home, and we're working from home, teleworking. And yes, thankfully, we have been healthy. And but I do have family members who are at risk, and so that's a huge concern for me as well.
Right.
And that's where, I've been coming to you and asking my questions. What about, my dad and my sister who are looking at a kidney transplant coming up this month?
Right. And we definitely, definitely the sense in the health community is that if those surgeries aren't necessary because they're not treating something that's life-threatening, they should be postponed. So elective surgeries should be postponed. A lot of it is because you don't want to take up the healthcare resources, and you don't want individuals who are having elective surgery in an environment where a lot of sick people may be coming, especially if there can be the asymptomatic type spreads. You just don't want to invite people that don't need to be in hospitals right now into a hospital environment because there are sick people going there. But you also don't want to tie up hospital beds or healthcare workers to take care of people who are just taking elective surgeries at this point because the threat that we're going to overwhelm our healthcare system is significant. And so we need to try and do what we can to not see that happen. And that's one of the reasons that we're self-isolating, because if we can sort of slow the rate of spread in the population, then we can let our healthcare system sort of get to the other side of flu season, because flu season's a big deal this year. It's a big deal every year, but it's a bigger deal this year.
And you were telling me especially for younger ages this year.
That's right. For actually young adults under the age of 40, for young adults under the age of 19, for kids under the age of 10, flu season is worse this year than it has been in a very, very long time, including for many of those age categories worse than 2009, which was the last year that we had epidemic numbers in the U.S.
Okay. So what we're doing right now to combat the coronavirus is also helping us combat the flu as well.
Absolutely.
So it's not only, we're double trying to hit both of these things.
We are. Everything that we do to help contain SARS-2 or stop the spread of SARS-2 is going to be as effective, if not more effective, in stopping the spread of flu, because SARS-2 is a hardier virus than flu is. And so if we're preventing the spread of SARS-2, we are definitely preventing the spread of flu.
Okay.
But flu, we have vaccinations and we have medications if people come down with the flu. So there's a medication you can take within the first 48 hours that helps stop the replication of the flu inside your body. And that's what Tamiflu does, and oseltamivir. We also have vaccinations against flu. About 50% of the American population got vaccinated against flu last year. Those stats aren't out for this year, but so that's good. Those things are keeping the number of cases down, but we still have over 22,000 deaths that have been attributed to flu this year. We have over 100,000 hospitalizations, and we estimated that probably around 35 million people in America alone have been infected with flu this year. So it's a big deal.
Yeah.
We just don't talk about it because we kind of feel like we've got control of it in the sense that, well, you could get vaccinated, you could take a drug, you could go to the hospital, but still a lot of people die every year. But if we compare flu mortality to this projected mortality on those global levels that we're talking about, if this really is a 4% mortality, and if we experience that here in the U.S., that's 40 times higher than our annual flu rate of death.
Wow.
So so that's
we need
very
to take this
significant.
seriously. Obviously, and this is the best thing we can do for our communities is to just self-isolate right now at home.
And we're all naive. None of us have ever had this virus before, right? So there's no immunity in the population, right? So that's another factor that makes this a lot worse than flu. But
Well, I've heard you talk a little bit about morbidity and the issues surrounding that. And I hadn't heard a lot of that conversation. I'm sure it's common in your field. But could you share a little bit about that and kind of maybe some of the at-risk folks?
So with SARS-2, the greatest risk seems to be to the elderly, and by the elderly, really they're saying over the age of 70, your risk increases to, I think the mortality rate over 70, I should have looked these numbers up before we started this. I'm sure I'll be able to remember them. It'll just take me a minute. So between 70 and 79, the mortality rate is around 8%. And between 80 and older, 80, 89, 90, 99, the mortality rate in that group as a whole is around 15 to 16%. 60 to 65 is about 3%. And so less than 50 is less than 0.5%. But they have actually seen deaths in all age categories now. Very, very few in the very, very young. But even infants and small children, they've had a couple of deaths, I think, that have been reported at this point in time. I think last time we talked, they didn't have any. And so they are seeing that even people that get the virus and are asymptomatic, they thought that they were healthy, normal after recovery, and yet they're finding that a lot of cases they actually have depleted lung capacity. So the virus has actually gone in and done some lung damage. We don't have any idea if that's going to be persistent. There's good reason to think that the lung actually can sort of rejuvenate itself and you can regain capacity, but that's speculation at this point. In addition, if you have comorbidities, if you have underlying illnesses, the ones that are associated with really poor outcome in SARS, in MERS, and in SARS-2, all of those are coronaviruses that have fatalities associated with them. Those comorbidities are diabetes, high blood pressure, heart disease, kidney disease, and obesity in the case of SARS-2. All of those are cofactors for poor outcome. Let's see, what else? I don't know. I can't think what else. What else have I told you that...
Those are the things I've heard of, so that's what I remember. I had a question from somebody who had asked about, the origin. You talked about the origin was the first SARS. This go around, they talked about bats and that process.
So bats are nasty. Stay away from them. No, there are hundreds of different coronaviruses and other viruses that they've detected and isolated from bats. And it's not every bat. Different bat species are associated with different viruses. But SARS in 2002, 2003, MERS, Middle Eastern Respiratory Syndrome virus from the Arabian Peninsula, was introduced into the human population through camels, but everyone thinks that it got into camels through bats, probably fruit bats. In the case of SARS 2002-2003, that came through civets and another exotic animal called a raccoon dog, because it really does sort of look like a crossed a raccoon and a dog. But it came from bats into those animals. And so with this one, we haven't identified an intermediate animal. But if you look at the sequences of the viruses and you compare the similarities of those that you get out of bats and those that you get out of people, this one has a very high similarity to the ones you get out of bats, but it's not so high that we think it was a direct introduction from bats to humans. Okay. Does that make sense? So like for SARS, if we compare the human virus to the virus we got out of civets, it's 99% identical. And if you compare those viruses to a bat virus, it's about 80%, right? So there's dissimilarity there. So yet we can see some of the residues in a civet that are also in the bat. And so we know that the civet was the intermediate. Okay. Now you compare SARS-2 to the bat viruses, and you have about an 85, 89, 95% similarity, but it's not 99%, right? And so you would expect it to be a higher percentage if it came straight from bats into humans.
Okay. So, because that was the question, because a lot of people started asking me because I went to China, do people in China really eat bats? And so this
They don't, do they? I don't know.
Well, there's a lot of interesting things that happen, and so one of the questions was, if that was the case, if somebody directly got it from a bat in that way, why...
Touch my face, don't do that.
Why would they not get more food poisoning? How does that virus then transfer if it worked through that way?
Well, so the interesting thing about coronaviruses, not flu viruses, but coronaviruses, is that they're not just respiratory viruses. They're also enteric viruses. So about 30% of people who get coronavirus infection with SARS, MERS, or SARS-2, they have a GI, an enteric symptoms as well. And so you can have respiratory symptoms. You can also have enteric symptoms. Okay. And so that's the other thing with SARS. Flu, basically you get that through droplets. You can get SARS through droplets. Both of those viruses can be aerosolized, but it's primary transmission through droplets and through contact. So where respiratory droplets have touched the surface and somebody comes along and touches the surface and then touches their mouth or their nose or their eyes. But with SARS isn't just in your respiratory droplets. It was isolated from sweat, from tears, from saliva, from urine, and from feces. Not from breast milk, though. So
that's like
that's
superpower.
Yeah. So SARS basically is pretty much secreted from every human fluid, I guess, is one way to put it. And flu isn't. And so SARS is much more potentially contagious that way because all you have to do is sort of come in contact with any of those fluids that have virus in it. So
very easy to do.
It is, yeah.
Okay. So we talked about bats, where it came from, SARS.
And we don't, just to reiterate, we don't know where SARS-2 came from. Although it probably started in bats, it probably didn't come straight from bats.
Okay. One question that I had in general that you sent me a document, let me pull it out here real quick.
Oh my goodness, okay.
Yes,
is this the coloring book?
Yes, for all the parents out there with kids. It's kind of funny, which we need a little bit of humor during this time too, to just kind of lift our spirits. But this is, Connie has coronavirus, and it's a 12-page coloring book.
That's amazing.
But it's great. It's got some great things on here of what kids can do. And there's a page in here that talks about why they call it the coronavirus. It talks about the bats and camels even, and that scientists are doing research on if there's other animals.
Yeah.
And that it can't go to your cats or dogs.
We don't think so. I mean, there's only been one. It doesn't look like it. There's been one dog in Hong Kong, I think, that had a very low virus titer, but it didn't seroconvert, so it whatever it had, it didn't have it long enough or strong enough that it mounted an immune response, and the dog never got sick. So maybe the dog was infected, but it didn't cause disease in the dog, and it didn't seem to set up a productive infection in the dog.
Okay. Well, in here it talks about, it's called the coronavirus because
yes, not because it has anything to do with Corona beer.
Correct.
Corona beer is still safe really to drink.
For Corona, but bad timing on that.
Bad timing.
But it looks like the sun. So
It does.
That's what they talk about. It is.
And the sun has a
so
corona around the outside.
Yeah.
And corona is actually, I guess, Spanish for crown. And so a lot of people think that it looks like a crown because it has these spikes sticking out of the outside of the virus. So.
And I should have brought the ones that my daughters actually colored because they've been coloring this. I printed off a new copy tonight. But there's a picture in here where they say, you know, scientists are doing experiments. Can
This is what I was talking about.
guess what is next? And my eldest drew a unicorn. She thinks they're going to find it in a unicorn. So we'll see if that is true or not.
Well, if they find it in a unicorn, that'll be quite the prediction.
Yeah. So some helpful tools for your kids. I think the biggest thing on here that's been helpful for me and my family too, talks about washing hands. And I know we see a lot of stuff on the internet where it says 20 seconds, and AJ has corrected me.
I am a firm believer that it should be 30 seconds. And there was actually a little bit of sort of a home-based experiment that I didn't do, but someone else did. And they actually washed their hands for different durations, and then they came on with something called germ glow, and then held their hands underneath a black light. And they didn't actually do 20 seconds, but they did 15 seconds, and they did 30 seconds. And there was significant difference between 15 seconds and 30 seconds. And so, and I think that most people tend to cheat, and so, you know, tell them 30 seconds. But the important thing is to wash your hands all over, to wash in between your fingers, to wash the knuckles, around your thumbs, your wrists, the back of your hands, with soap that will lather. And so if you're using some kind of soap that never develops a lather, you probably aren't doing much. So you want soap that lathers. About 30 seconds. Be diligent. Try to get underneath your fingernails too. Warm water is by far better than cold water. So warm water, 30 seconds to a lather. And then use a paper towel or whatever you dry your hands off with to turn the faucet off. Yeah. Okay. And do it a lot. I challenge people in my church to try and do it, 10 times a day? I haven't actually gotten up to 10 times a day, but I probably get close some days, 6 or 8 times a day.
I feel like I'm doing like 50 times a day with the girls. But
Good for you.
I haven't been doing the length of time, and so that's where I need to up my game.
Yeah, and so, you know, whenever you come back into the house from being out, wash your hands. Certainly before you eat, wash your hands. Certainly after you use the restroom, wash your hands. And I think the other really important thing to do, very important in fact, is to at least once a day wipe down the surfaces in your home, the doorknobs, the light switches, anything that you guys touch a lot. And I suggest you use Clorox wipes or a bleach wipe, or make up your own bleach solution. And the reason I say bleach is because SARS is a hardy virus, and you want the bleach solution to probably be a 5% or a 10%. If it's a 10%, you should probably make it up fresh every other day. If it's a 5%, you should probably make it up fresh every day. So don't make gallons and gallons. You know, just make up a quart or a pint and put it in a small spray bottle and spray the surface, let it air dry, and then wipe it off, because bleach can be corrosive, so you don't want to leave it on surfaces, but you want to let it air dry, because that's what actually, that time contact is actually what's inactivating the virus.
Oh, I didn't know that.
Yeah, okay.
That's good to know.
Glad we had this chat.
Yes, so now I'll have cleaner. Well, I do, I mean, when I do the Clorox wipes,
Right.
I
So don't spray it down and wipe it off. Spray it down, let it dry,
Okay.
and then come along 10 minutes later after it's dry and wipe it off.
Okay. We're still healthy, thank goodness, but.
Yeah, right. I mean, it's going to help. Even if you spray it down and wipe it off, it's going to be better than not having done something, right?
Right.
And that's the same thing with hand sanitizers. They're not as good as washing your hand. Low concentrations of alcohol like that in hand sanitizers, which is typically about 61, 62%. It's the wrong kind of alcohol for SARS. It's good for flu, but it won't completely inactivate SARS, but it's better than nothing, because it'll inactivate some of the SARS.
Okay.
Yeah.
So I've got more, those are kind of the, big picture of what's going on with it. I just want to throw in a personal one for me, but I also have talked about this with a lot of my friends as we're considering everybody's trying to figure out, how do I work, if I can work, teleworking, and if you have kids involved with that, especially you've got your doctors, first responders, all the people who are essential to protecting and keeping society safe, their kids have to go somewhere, and so there's still daycares that are open. And so for those of us like teleworking, do we send our kids to daycare? Do we try to figure out a way to, you know, keep them at home? And so I have a colleague who was talking about, you know, she, you know, if she puts her daughter in daycare, you know, and then she's got grandparents that also watch her daughter, you know, how do we figure out all these things?
Boy, it would probably be a case-by-case situation, but I would just tackle the one that you mentioned there at the end, which is if you have young kids that sometimes go to daycare normally, under normal conditions, and sometimes go with grandparents, that today you shouldn't be doing that. You should choose. Either your kids are going to go to grandparents, and in that case, they should have minimal contact with other kids and other people outside the home, because the grandparents will be the more susceptible population. And if they're going to go to daycare, then let them go to daycare, but realize that as they go to daycare, their chances of coming in contact with somebody who has the virus is going to be higher. The risk to the child is probably not going to be huge, but you know, the risks are still there, and oftentimes, unfortunately, maybe not often, but nevertheless, oftentimes some of those comorbidities they can exist in kids, and you just don't know that your kids have underlying conditions.
Right.
Whoa, like that.
And we're back.
Like, you just don't know underlying conditions, like the camera's going to fall, right? Anyway. Boy.
Right. There we go. We're back up.
Was I hitting the table, or was it just its time?
Right.
Maybe there was
Southern
a little
California could have been an
mini earthquake.
Yeah.
Who knows? We'll
that.
go with that.
Yeah.
We're kind of low on the camera. It's chopping our heads off now.
It is. Let's do that.
There you go. Okay. Will it be the same? There you go.
Yeah.
Okay.
Well, that's
So I would choose, and it would be a hard choice, I know.
Yeah.
But you know, I think one of the things, I think you and I've talked about this, is that the object isn't to, I don't think that we're going to be able to achieve elimination of the virus in the population.
right.
And really the types of things that we're doing now, they're not extreme enough for us to actually achieve that, right? We would need to, basically everybody would need to self-isolate, or you isolate and never go out, right? You never go to the store for groceries or anything like that.
Right.
Then that might stop the spread. This seems to have a pretty high, what's called a replication factor, which is how many people can one infected person pass it to. And for flu, that number on average is about one infected person will pass it to 1.5 to 2 other people.
Okay.
But we have base immunity in the population, and we have vaccinated population. And so, you know, so flu probably has a pretty high number for the replication factor, but it doesn't seem that high because we have a partially immune population.
Okay.
SARS-2 has an estimated replication factor, how many people I could pass it to if I was infected, of 2.5 to 3. And so that doesn't sound like a lot, but we know that there are also super spreaders. So there was one person in China in February, I think the beginning of February, that one person gave it to 13 healthcare workers.
Oh, goodness.
We know that in the U.S. there was a pharma meeting in the Boston area where at least one infected person was attending that 2-day meeting with pharma execs. It could have been 2 or 3, but at least one person. Over that 2-day period, 77 people became infected. And so there are super spreaders. There were with SARS back in 2003 as well. So the whole thing is that we're not going to be able to totally eliminate the spread unless we're all basically in quarantine or self-isolation. And quarantine is isolating the sick, or the healthy, and isolation is isolating the sick. But unless we're taking those drastic measures, we're not going to be able to stop it. And it's all around the world already in 160 different countries. So what we're really just trying to do is to avoid a really rapid rate of infection with a lot of cases and a lot of fatalities at once, because we want to, what they're calling, flatten the curve. right? And that's all about not overwhelming our healthcare system.
Right.
And to be able to keep the curve low, to get it to bend the curve, to keep it low, especially while we're still in flu season, which should end the middle of April to the first week of May, somewhere in that time period.
Okay.
And so that's why we're all doing what we're doing right now. We're trying to bend that curve while we're still at the beginning, while we're still in flu season. But now back to the kids, eventually what we would like to see is we'd like to see sort of a low level spread through the population so that most of the population develops immunity, so that we have, as a population, what they call herd immunity, which means if one person gets sick, the chances are that they'll pass it to somebody else has been eliminated. It's that number has dropped below 1.
Okay.
And if that number drops below 1, then basically what it means is, well, yes, I'm sick, but everybody I came in contact with was already immune, right? And so occasionally there might be one person I came in contact with that's not immune, but they're saying that herd level of immunity for this pandemic is probably around 70-75%. And so that's a lot of people. If you think every 3 out of 4 people need to have this virus in order for us to basically get rid of the possibility of having local outbreaks over and over and over again that we have to be concerned about, right?
So it's kind of a paradox in a sense.
It is. Sort of like us, a paradox.
Right, a paradox.
There you go.
Yeah.
Yes. Anyway.
It's fascinating because it's like, in a sense, you hope that it is the healthy people who are being able to fight off this virus. Because I was also thinking, I think because we see these reports of